Hello, thank you very much for listening to my presentation, which is part of my PhD on developing a syndemic framework looking at how we frame comorbidity and multimorbidity in dementia care. My name is Rosie Dunn, and this presentation is a collaboration with Ellie CLAYTON and my PhD supervisors Emma WOLVERSON, Andrea HILTON and Elizabeth Price at the University of Hull. So we know from the literature that dementia rarely travels alone. People with dementia experience on average 4.6 health conditions and often experience poor quality of care, increased risk in polypharmacy and mortality, and a reduced quality of life. Now, there are two common terms used to describe people who live with multiple health conditions: comorbidity and multimorbidity. However, these definitions appear to overlap conceptually, and there is very little understanding around how appropriate these definitions are in the context of people living with dementia. And the reality is that people with dementia live with multiple health conditions, and this is the norm rather than the exception. They and their families have to navigate across multiple health services, retell their medical history to different practitioners, and learn how to self-manage at home. In the UK, healthcare policies focus on the assessment and treatment of singular index diseases. So we carried out a scoping review to compare the definitions used to describe comorbidity and multimorbidity in the dementia literature. From the findings, we developed an operational framework to help guide future research, policy and clinical practice in dementia care. And we aim to address two research questions. One, how is comorbidity and multimorbidity defined in relation to people with dementia in dementia research? And what are the key conceptual components that form these definitions? And two, how do these definitions incorporate the complex needs of people living with dementia and multiple health conditions? So we carried out a content analysis which revealed 5 key themes. We found that all but one definition focused on chronic conditions and didn't consider acute conditions. Additionally, only 3 definitions referred to the inclusion of mental health. And this is surprising given the high prevalence of acute and mental health conditions in people living with dementia. We also found that the definitions used highly medicalised language, so for example, terminology such as pathology, disorder, disease, which is relevant given the importance of language in highly stigmatised conditions such as dementia. The majority of comorbidity and multimorbidity definitions describe the co-occurrence or coexistence of conditions. However, only 3 definitions considered that conditions could actually influence the onset of another condition, which again is relevant in the context of a lengthy chronic illness such as dementia. We also found that over half of the comorbidity definitions did not describe the inclusion of an index disease, and only 4 multimorbidity definitions explicitly described not including an index disease, which are both in contrast with the original definitions. Comorbidity definitions described only 2 coexisting conditions, and multimorbidity definitions described more than 2 conditions. And this is in line with original definitions. However, it's important to remember that people with dementia have on average 4.6 health conditions. This scoping review found that the definitions used in the dementia literature are varied, overly simplistic and disease-focused, with considerable overlap between the 2 different definitions. Crucially, there were many key elements and concepts missing from these definitions that failed to capture the intricacies of people with dementia living with multiple health conditions. So we argue that instead of trying to reduce down this paradigm into a definition, we should take a syndemic approach, which goes beyond the existence of parallel conditions and instead focuses on the interaction of biological, social, environmental, economic and lifestyle factors that are intertwined with one another. In addition, we advocate that the severity and type of dementia, people's perspectives and experiences, psychological and social factors, and polypharmacy are also important considerations. Our framework can be used by clinicians, healthcare services, and policymakers to help improve their understanding in this area and provide holistic, person and relationship-centred care for people with dementia living with multiple health conditions. Thank you so much for listening to our presentation. If you would like to get in touch, please send me an email or access our details on our brand new dementia website at the University of Hull. Thank you.